Is a procedure that can be used for diagnosing and treating a number of heart problems. Earlier, I sat down with Rochester General Hospital cardiologist Tim Malins to talk about cardiac catheterization in this week's Your Heart and You. Cardiac catheterization is a test on the heart, right?
That's correct. We've been doing them routinely for the past 25 years, and unlike your typical stress tests, which people hear about all the time, this is a test that looks directly at the coronary arteries themselves. What we do is we'll take a small little catheter and either put it through one of the arteries in the leg or in the wrist, and we'll feed it up to where the aorta, off of the aorta where the arteries come, and we squirt dye down and then take an x-ray. And as you can imagine, if there's a narrowing in one of these arteries, it almost kind of looks like an hourglass and will kind of open up.
So how do you decide whether to give a patient cardiac catheterization as opposed to many of these other tests?
That's a phenomenal question, because that's been on the forefront of the news and studies. And what we do is people who are very high risk, people who are in the middle of a heart attack, and that's where we really get the biggest bang for the buck. We didn't have this 30 years ago, but now in the middle of a heart attack, we can see it on EKG, we can rush them to the coronary cath lab, do this, and not only do the diagnosis of see where the narrowing is, but then go in and put a balloon, open up the artery, place a stent, which is kind of scaffolding in that artery to keep it open, and restore blood flow.
So you can test the heart and treat it at the same time.
Yeah, it's a beautiful, beautiful procedure.
But should every heart patient have one of these procedures?
Absolutely not. And it's the same thing with the stress test. Not every heart patient needs a stress test. Without symptoms, for the most part, you don't need stress tests. Coronary catheterizations or heart catheterizations are done for the most part for people who have had a positive stress test or continuing to have symptoms or having a heart attack.
All right, Dr. Tim Malins, thank you.
Thanks, Maureen.
For more Your Heart and You segments, head to our website, rochesterhomepage.net.